Hi everyone. Today's video is on types of hypothesis. In the previous video, I have discussed what is hypothesis, what are the differences between research question and hypothesis, what are the functions of hypothesis, characteristics of hypothesis, how to word hypothesis, sources of hypothesis, and derivation of hypothesis, that is inductive and deductive hypothesis. Actually, my plan was to cover in this video, along with types of hypothesis, testing of hypothesis also. But it is little vast and little complicated. I am so restricting it with hypothesis types. What are the different types of hypothesis? Simple hypothesis, complex, associative, causal hypothesis, directional hypothesis, non-directional, research hypothesis, and null hypothesis. We will see one by one. What is simple hypothesis? Simple hypothesis expresses an expected relationship between one dependent and one independent variable. Here only one dependent and one independent variables only. That is why it is called simple hypothesis. Some examples are smoking. It is a prominent cause of lung cancer. Smoking causes lung cancer. So, smoking, independent variable, lung cancer, dependent variable. So, cause and effect. Cause is smoking and it cause effect on the dependent variable, that is lung cancer. Consumption of sugar-rich foods daily results in obesity. So, here sugar-rich food consumption is independent variable and dependent variable is obesity. Third example, there is significant difference in the subjective well-being of elderly before and after music therapy. Which is the independent variable here? Music therapy. Dependent variable is subjective well-being. Next one is impact of social media on attitude among undergraduate students. Again, independent variable is social media. So, impact of social media can change the dependent variable attitude. Then comes complex hypothesis or multivariate hypothesis. So, this predicts the relationship between two or more independent variables and or two or more dependent variables. We will see with examples. Either it can be two or more dependent variable or two or more independent variable. Individuals who take balanced diet tends to have higher immunity, lesser cholesterol, and high metabolism. Here, independent variable is balanced diet, and that may affect many dependent variables: immunity, cholesterol level, and metabolism. Short breaks during work hours can lead to higher concentration and better productivity. So, independent variable is short break. Higher concentration and better productivity are dependent variables. Functional limitations of women with multiple sclerosis are influenced by education, marital status, social support, employment status, and perceived economic adequacy. So here, functional limitations of women with multiple sclerosis or functional limitations is the dependent variable, whereas all the others, education, marital status, social support, employment status, and perceived economic adequacy, all these are independent variables. So here two or more dependent or two or more independent variables are there. That is why it is called complex hypothesis or multivariate hypothesis. Again, one simple example for complex or multivariate hypothesis, that is taller people and low caloric intake affects the weight. So, independent variables are taller people or low caloric intake, dependent variable weight. Again, smoking can cause lung cancer or coronary artery disease or other diseases. It may affect the many other systems. So smoking can cause lung cancer, CAD. So here one independent variable and two dependent variable. Next is directional hypothesis and non-directional hypothesis. Directional hypothesis specifies the expected direction to be followed to determine the relationship between variables. So here direction is given. So which direction? In the positive direction or negative direction? But in non-directional, as the name implies, no prediction. No, it is not predicting the direction or nature of the relationship between two variables. Directional hypothesis predicts the nature of effect of the independent variable on the dependent variable. But in non-directional hypothesis, it predicts that the independent variable will have an effect on the dependent variable, but the direction of the effect is not specified. So it says that there is a difference, or the independent variable makes a difference, but the direction of the difference is not specified. Directional hypothesis is derived from theory because we know this is the direction. Because we through the review of literature, we know that, or we learn the theory based on our problem or based on our research question. So we know what is happening or what has happened. So it is derived from theory. That is why it is called one-tailed hypothesis. Direction is given. Non-directional used when there is no theory involved or when findings contradict previous research. So previous research findings are contradictory. That is two-tailed hypothesis. In directional hypothesis, it predicts in which direction the change will take place. That is greater, smaller, or less, more. Example, children learn computer faster than adults. So here direction is given. Children learns computer faster than adults. In non-directional, it just states that there will be a difference. Example, there's a difference in learning of computer by children and adults. No, it is not giving direction who is better, children or adult is not specifying. Only it says that there is a difference. Then associative hypothesis identifies variables that occur or exist together in the real world. Here, when one variable changes, the other variable also will change. For example, there is significant relationship between biopsychosocial problems and quality of life of senior citizens. Then comes causal hypothesis. It identifies a cause and effect interaction between two or more independent and dependent variables. Example, there is significant difference in the depression scores before and after cognitive behavior therapy in patients with attempted suicide. So it gives a cause and effect. So here cognitive behavior therapy and depression scores. So independent variable is cognitive behavior therapy. Depression scores are the dependent variables. So here cause and effect relationship. Research hypothesis. So all these we have discussed are research hypothesis. So we have already discussed in the previous video what is research hypothesis. It is a supposition or conjecture that motivates the research. That is, it is a tentative prediction or assumption that motivates the research. It may be proposed after numerous repeated observation. Research hypothesis lead directly to statistical hypothesis. So research hypothesis or scientific hypothesis are statements of expected relationships between variables. So even though different types of hypotheses are stated, all these comes under research hypothesis. Then comes statistical hypothesis. Statistical hypotheses are evaluated by appropriate statistical techniques. So here comes the use of statistics. So appropriate statistical techniques are used like parametric test, non-parametric test, inferential statistics are used to test the statistical hypothesis. There are two statistical hypotheses involved in hypothesis testing, that is mainly null hypothesis and alternative hypothesis. Null hypothesis is designated as H0 and alternative hypothesis as H1. So these are mainly research hypothesis and statistical hypothesis, and statistical hypothesis can be null hypothesis and alternative hypothesis H0 and H1. So these are all about the different types of hypothesis, and now we will see certain guidelines for critiquing research hypothesis. Because when we write the hypothesis, we have to check whether the hypothesis statement is correct or not, or properly stated. So in order to make sure, there are certain guidelines for evaluating the hypothesis. 1. Does the research report contain formally stated hypothesis? If not, is the absence justifiable? It is not always needed to have a hypothesis written in a research report. It depends upon our study. Sometimes in a descriptive study, survey study, especially in qualitative studies, a formally stated hypothesis will not be there. So, if we are not using it, is the absence justifiable? Are the hypotheses logically and directly tied to research problem? We have already already discussed that research hypothesis is a rewording of the research question. So research question is, in another way, the statement of the research problem in the interrogative form, in a questionable question form. So are the hypothesis, or is the hypothesis logically and directly tied to research problem? Do hypotheses flow from a theory or previous research? Is there a justifiable basis for the prediction? Can your hypothesis be tested? Does your hypothesis include independent and dependent variables? Do they state a predicted relationship? Do the hypotheses indicate the nature of population being studied? Are hypotheses properly worded? Are the independent and dependent variable adequately defined? Are they measurable? So, whether these variables are defined, conceptual definition as well as operational definition. If we have these guidelines or the checklist with us, we will be able to state a proper hypothesis. So that is all regarding the types of hypothesis and how can we check whether the written hypothesis is correct or not. So that is all about in this video. So next video, I am planning to discuss on testing of hypothesis. Please do give your valuable comments and suggestions. Thank you.